from the Ministry of Health and Child Care, Reproductive Health Unit under the Family Health Department. Talking about obstetric fistula, it is a devastating condition suffered by women during childbirth. So it can result in a hole developing between the bladder and the birth canal, or the rectum and the birth canal. These are the two most common types. There are other types which are rarely encountered, but these are the top most common types of obstetric fistula. So if a woman encounters that injury, she will not be able to control her urine. So urine will just be dribbling down on its own without her being able to stop it or control it. If it's the rectum which was affected and the hole connects the rectum to the birth canal, then feces will pass through the birth canal when she passes urine and when she passes feces. And the condition is worse when she has diarrhea. So this condition results in a lot of problems for the woman. Physical problems which result in infections. So I'm combining physical and medical, which results in infections, the urinary tract infections and other infections. And also because of the continuous wetness of her private parts, bruises and at times deep wounds, ulcers can actually develop. And also because the woman usually is not in a position to maintain and sustain good hygienic conditions. Mind you, this problem affects the most commonly marginalized people in the community, those who are very poor, those who live far from facilities, and young adolescent women are at higher risk of this problem. I am not going to go deep into the processes and the condition of the condition and how the effects are experienced by the woman. I will leave this to the speakers who are going to follow me. But let me talk about the programming. So before 2015, Zimbabwe as a country did not have a fistula repair program at a public health level. Fistulas were being repaired, but in higher level hospitals like our tertiary hospitals or private hospitals, and it was expensive and far from the reach of the ordinary woman who is mostly likely to be affected. But in August 2015, the Ministry of Health opened Chinhoyi Provincial Hospital as the public facility for obstetric fistula repairs. And this was conducted by the ministry with its partners, mostly UNFPA and WAHA. Then now it has rebranded to Artemedis. So this program now offers free treatment to the women affected. Everything is paid for, including their bus fares, their stay in hospital, their surgery costs, and their post-operative care. It's paid for through the ministry and its partners. So we started the first such camp in 2015 August, and up to date we have repaired 1,894 women. So it means that a lot of men are suffering in the community. And we had a woman who was now 79 years at the time of repair. She had stayed with the fistula problem for 47 years down in the community there. She didn't know where to access the services. She was told of some hospitals which were carrying out the surgeries, but she didn't have the funds. She couldn't afford treatment, and she was just suffering there. These women usually face stigmatization from the family, from the community, or even self-stigmatization. They feel like they are not worthy mingling with other members of the community, and in most times you find they have a secluded hut where they spend most of the day there. They do not want to mix with visitors. They do not attend social events, even burials, church gatherings. They are not comfortable. If they are confident or brave enough to do so, they usually face untoward attitudes from the others because of the smell they will be emitting from the continuous urine and feces. So as a program, we are looking forward to identify those women, link them to care, bring them to the healthcare system so that they can be repaired. We know that obstetric fistula is actually hinging on infringement of women's rights, which are human rights. They do have a right to a dignified life, just like you and me. So we are making efforts to identify these women, bring them back to care, let them have repairs done and reintegrated back into their community so that they live a normal life with their community members. So to this effect, we have a toll-free number where even if they do not have airtime, they can phone to be booked for surgery, and the phone number is 08080231. I will repeat it again, 08080231. So you can actually share this number so that we help the community to have knowledge of the available services, so that they know that they can be repaired, so that they are booked for operation and they are repaired. Thank you so much.